In today's Health Watch, a myriad of symptoms led a Stevens Point mom to talk to her doctor. Local 5's Caitlin Corbett tells us why advocating for herself changed her life.
Whitney Sinclair was experiencing symptoms that she thought could be perimenopause. But how do you know when it's that or if it's something else?
Last year I started having very random night sweats. I wasn't having them all the time, but when I had them, they were almost debilitating. It was really affecting my sleep.
For Stevens Point mom Whitney Sinclair, this was the first sign that something in her body was off.
And then I started having just some vague symptoms that I really attributed to being in my 40s and having had a couple kids and a couple C-sections. Changes just in my pelvis with sensation, changes in lifestyle, changes in the way my body was functioning. And I really just thought, gee, I should have taken better care of myself when I was in my 30s.
Sinclair thought it could be perimenopause, but with a family history of cancer, she decided to get checked out. When a CT scan revealed a large mass in her uterus, she was referred to BayCare Medical Center.
I knew that until this mass was removed, I was going to continue to have anxiety and really wonder what it really was. And I work in the medical field. I know just enough about these things to worry myself. And so when they said, hey, we can take this out and maybe it'll help some of these symptoms too, I said, great, let's do it.
Sinclair was a candidate for a robotic hysterectomy, a less invasive procedure to remove the uterus with less recovery time.
With the robot, it's actually a 3D visual technology. So instead of having a traditional 2D screen that's there, we actually in our viewer can see 3D. So we can get closer to the mass. It's basically like taking my face and putting it right next to where the mass is to be able to then take it out in a way that we wouldn't have to necessarily make a big incision to remove it.
After the robotic hysterectomy came a huge relief. Sinclair's mass turned out to be non-cancerous fibroids. She went home the same day and was even able to have an umbilical hernia repaired during the procedure.
I had to do so little to get this taken care of. Once we found the mass, Dr. Dixon's team just took care of it for me. They answer questions I didn't even know I had.
While Sinclair couldn't have predicted the outcome just 1 year ago, she's grateful she listened to her body.
It's really easy to say, is this really something that I'm sensing in my body or am I just being anxious? And it took me a really long time to not be embarrassed about going to my doctor and asking to be aggressive with figuring out what was going on.
BayCare is currently performing robotic procedures in urology, cancer care, women's health, and a variety of general surgery applications. To learn more about health care for women at every stage, visit BayCare's website. And that's your Health Watch. For Local 5 News, I'm Caitlin Corbett.